seasonal affective disorder?
Well, actually, it's a form of depression that's associated with this time of year. Some people can have it in the spring and summer, but typically it's most common in the fall and the winter. And a lot of this is being attributed to the fact that there's less hours of sunlight, where we get that sunlight, just that positive feeling. It's so beautiful behind me right now. But during this time, there's less sunlight, more cloudy, more gloomy. People have a decrease in a hormone called melatonin. Melatonin, it kind of makes us feel better about things. And also our serotonin can be down during this time of year. These are attributed to this seasonal affective disorder, which is a form of depression.
What would you say is being observed as the cause of this problem now?
Right. What I was saying is there's a decrease in certain hormones that are being articulated in the research. Our melatonin, our serotonin, these are some of our neuropeptides or hormones in our brain that makes us have a happier feeling. Some of the treatments actually bring these serotonin up, which can make us feel a little happier. But the deal is we don't want to ignore it, because the worst case scenario is someone could be so depressed that they could take their own life.
Yeah, we absolutely don't want that. I'm sure you see this in your patients. How is it treated, Dr. Quinn?
Well, you can use certain medications. Psychotherapy is good for some people. They might not need the medication. But interestingly, my daughter was in college in New York, of which she graduated 2 years ago. And they had, the school nurse had what's called a light box room. New York is on the East Coast. It gets even more dark earlier on the East Coast than it does south as far as Mississippi. And they would go in this room, in this box. It had like this light at a certain wavelength you would do for so many hours a day. Maybe my daughter told me you would go in there and study while the light is shining on you. Maybe of course she didn't have a big bald head like me, but it shined on your face and your skin, and it would actually raise those levels. And some people would report feeling much better, not needing the medication, but they would do that with therapy, of course.
Gotcha. Okay, real quickly, Dr. Quinn, if there's one last thing that you'd like our viewers to take away from this, what would you like that to be?
Do not, I repeat, do not ignore signs and symptoms. If you or someone else is feeling sad, tired, maybe crying spells, just don't want to go to work, talk to your medical provider. You might have this condition, and if it's caught early, treatment is very effective. If caught late, it might be too late, because like I said, some people can take their life.
Okay, thank you so much.